Is that better? Okay. Reactive versus proactive. Again, patients are coming to the office after they have illness, high blood pressure, diabetes, cancer, things like that, versus proactive when we can actually prevent disease and control illness. Many patients, and this is more the norm, that patients have more than one physician providing their medical care. So they may have a primary care doctor, a cardiologist, a nephrologist, and an endocrinologist. And all these physicians are writing prescriptions and no one is communicating with each other. So the patient is left with a pharmacy bag of pills. They may be taking 5 to 10 different medications at a time, and this puts them at risk for adverse reactions with the medications. Across the board, widespread, we see a decrease in insurance reimbursements. So you see physicians having to see more patients in their office to make up for that loss of income. And modern technology. What I mean by that is that nowadays we can extend lifespan, but not in particular their health span. So you may have a patient who has respiratory failure. We put them on a ventilator. And if they're on the ventilator longer than 10 to 14 days, then we have to do a tracheostomy. And with that, you have patients, they're lying flat in the bed, puts them at risk for bed sores, and it just puts them at risk for more and more multi-organ failure. So you're taking a look at that's extending their longevity, but it doesn't really improve their quality of life. Anti-aging medicine. Anti-aging medicine is defined as a clinical medical specialty and field of scientific research aimed at the early detection, prevention, treatment, and reversal of age-related decline. Aging is inevitable. Age is inevitable. Aging is not. The anti-aging model changes or slows the process of aging. What are the goals of anti-aging medicine? Again, we want to increase the health span, not just the lifespan. You increase your health span when you have the following: strength, vitality, happiness, creativity, contentment, and spiritual satisfaction. No one wants to live longer with chronic illness or cognitive impairment. There's no point in living to age 100 if at age 80 you're in a nursing home. You don't remember who you are, you can't make it to the bathroom, your hearing is impaired, your vision is impaired. That's not quality of living. Functional medicine. Functional medicine is an integrative, science-based healthcare approach that treats illness and promotes wellness by focusing on the biochemically unique aspects of each patient, followed by individually tailored treatments to restore the body back to balance. Functional medicine also focuses on understanding the fundamental physiological processes, the environmental inputs, and the genetic predispositions that influence health and disease, so that interventions are focused on treating the cause of the problem, not just masking the symptoms. So conventional medicine, we're treating symptoms. Okay, a patient comes in, high blood pressure, we put them on a beta blocker or a diuretic. Then what happens? They have a side effect. They have erectile dysfunction. Then what do? We put them on Viagra. So again, you're just treating symptoms, whereas functional medicine, you're actually getting to the cause of the problem. An example of that would be when a woman comes in, you want to, as you're doing her hormonal status, you want to check for estrogen metabolites. Estrogen is metabolized through 3 pathways. So you can see that if she's metabolizing her estrogen to the 2 precancerous pathways, well, we can shift that through healthy eating, appropriate nutraceuticals, things like that. So we're actually making a difference preventing breast cancer. Benefits of incorporating primary care with anti-aging and functional medicine. You have one physician guiding the total medical portfolio, so that aids in continuity of care. So you're the main focus, okay? And then if the patient still needs to see a specialist, whether it's a cardiologist, endocrinologist, what have you, you are communicating with those other specialists. You're monitoring if medications are being prescribed, and you can monitor to make sure they're not going to have drug-drug interactions. Again, we're treating the cause and not just masking the symptoms. And it just allows for preventing disease and illness and promoting health and wellness. There's increased gratification for the physician and decreased stress for the physician. So you're actually spending more time with the patient. You can, there's more counseling and education, and you're not running around trying to see 30 to 40 patients in a day. You're actually taking care of patients. You're not taking care of patients if you're seeing 30 to 40 patients a day. All right, you may be seeing them, but you're actually not taking care of them. Again, focus on biological age versus chronological age. It doesn't matter what your calendar age is. It's your biological age that determines your health status. And you're no longer under the restraints of the insurance companies. And many of us have dealt with, you want to order a test, and then you have to get on the phone with the medical director of the insurance company and debate with them why you want to order this test. And that's very frustrating in itself. These are the components that I feel are important in optimizing a patient's health, and we'll go into these in later slides in detail. Healthy eating, regular exercise, appropriate nutraceutical supplementation, adequate sleep, stress reduction, pulse electromagnetic field technology combined with pulse biofeedback, hormonal balance, detoxification, and when I speak of detoxification, I'm referring to phase 1, phase 2 liver detoxification, detoxifying heavy metals, and assessing genetic predispositions. Approach the evaluation of the patient. You want to do your initial comprehensive history and physical exam. You go back to your medical school, in-depth, comprehensive history and physical. You want to ask questions about allergies, medications, previous antibiotic use. Well, why are you asking these questions? Medications. If a patient comes in and they're on a statin drug, well, you know right away that they're on the statin drug. It's lowering their coenzyme Q10 levels. It's lowering their testosterone levels. It just gives you, you're getting a feel for their health status. A patient who's been using antibiotics, it can alert you that they more than likely have dysbiosis, so that as you start to treat them, you may want to first begin with the gut. Past medical history, you want to take a look at their emotion, ask them questions regarding any emotional loss or trauma during childhood, adolescent, or early adulthood. Why is that important? Because we know that when you have these emotional traumas, they can manifest later in life as physical symptoms. Family history, social history. In your social history, you want to ask patients about, are they satisfied with their current occupation? And you're asking that because lots of people are unhappy in their job, and that it's just another stress. It's a major stress factor for them. So it's giving you a feel for what their stress level is like. How long are they on their cell phone? Do they turn their cell phone off at all? Or how long are they on their Blackberries or their computers? There's lots of people who are going to bed, they're on their cell phones or they're on their computers. They're not taking any time to relax. Tobacco, alcohol, recreational drug use, that's just adding another toxin to the body. Religion and spirituality. You're asking those questions because you want to know, does the patient have a support group? When they need guidance, if they're very stressed, they're having issues with family, work, their kids, what have you, you want to know if there's some place that they can go, someone that they can talk to help ease their stress. Dietary habits, how many servings of fruits and vegetables are they getting in? Are they getting adequate water intake? Exercise, are they up to date on their dental appointments? Do they have any mercury fillings? Mercury is just another toxin to the body.